Nityanandam Paramasudam Kevalam Jnanamurtim Vandvadidam Gaganasarisham Tattvamsyavilakshyam Ekam Nityam Vimalamadavastutam Sarvadi Sakshibhudam Bhavadidam Trigurayidam Satgurum Tam Namami. Hello, friends. Welcome back as part of the Kailasa's Hindu Nation, Hindu Doctors Without Borders. This is the second panel discussion on obesity and overweight, a very important topic that affects millions of people worldwide from all aspects of life in so many different ways. During our first session on this topic, the panelists discussed various reasons and causes of this health issue. We are again very grateful to have this panelist to rejoin us in this second session. And it's important, essentially, not only this topic is misunderstood in so many ways, it's also approached in many incorrect ways, not understanding the full depth of the issue. That's why this health issue is difficult to overcome. People go on this endless cycle of losing and regaining weight, the yo-yo effect. A lot of people refer this to. The causes, the etiology of the obesity was discussed the first time when the panelists met. Today, they will discuss the effects and implications of obesity in all other systems of the body and mind, how it affects, how it the chain reaction effects on the rest of the body. And they will approach it from, again, multiple discipline and multiple in a holistic approach. And the last of this series that we will conclude the next time will address the management of the obesity after completely understanding the why and how of this important issue affects us. Again, to reintroduce our esteemed panelists, we have Pooja, an Ayurvedic doctor specializing in Panchakarma. She's joining us from Bangalore, India. And then we have Ishan Sun, specializing in acupuncture and herbal medicine, joining us from Ontario, California. And finally, we have Prema Kodanraman, a board-certified OBGYN and pelvic surgeon, and she's joining us from Los Angeles. So let me first turn to Ishan. Ishan, can you share how the obesity affects our body and the various systems from your perspective?
I feel that their causes are many, and it's difficult to say what began the process. Could be environment, could be diet, could be stress. However, I would say the effects of obesity, the biggest cause of concern is its association with fatty acids in the liver, what's named non-alcoholic fatty liver disease. The reason it's named non-alcoholic is to not confuse the situation with the alcohol-caused reason for fatty liver and cirrhosis and inflammation. So it's known as an unknown cause of fatty liver, but there's a big association with obesity. So what happens when too much fatty acids accumulate in the liver is that the insulin is affected. So it's associated with insulin insensitivity. So what happens when there's not enough insulin sensitivity on the cells is that the blood sugar starts to raise, because the insulin's job is to allow the blood sugar into the cell. So when that doesn't happen, the body starts to think it's starving. And so it triggers this survival mechanism. So when that happens, the body goes into more production of sugars. In the liver, it's called gluconeogenesis, where the liver starts to break down muscle and also structural fat to produce more sugar for the body, because it doesn't want to starve. again, it's trying to go into a survival mechanism because the brain and heart really need glucose, and it's not getting it. And when that happens, people start to have low blood sugar symptoms, even though the sugar in the blood is high because they're being starved. And what happens is the people start craving sugar, more carbs, more fast carbs to try to feel better. And what happens, it just worsens the situation. And one thing to note, when the liver goes into breakdown of muscle tissue, and also structural fat, which is the fat that protects the body and cells, the good fat, not the ones, the fat associated with disease or inflammation, which is more of the what do you call it, the abdominal fat, the visceral fat. So when that happens, the whole cycle of metabolism starts to go down, because any weightlifter or trainer will tell you that muscle burns more fat, more calories than fat tissue. So what happens is there's a ever growing issue with lowered metabolism as there's a muscle loss. So sorry, there's a lot of different things I'm trying to put together, because there's so many associations between different organs and the whole cascade. So I will share one by one. So when that happens, the liver gets when the insulin starts to be insensitive, sugar goes up, it stimulates a survival mechanism. When that happens, cortisol also raises because you're in a fight or flight situation. Cortisol then actually shuts down downregulates the thyroid, because it wants it to go into less metabolism and more into the fast sugars to try to get more sugar into your muscles. And so what happens is, over time, that there's an association with hypothyroidism. Another thing that affects metabolism is that the way of the liver affecting the thyroid is that when the fatty acids in the liver begin to rise, the T4 to T3 conversion, thyroid hormone, also gets affected. Most of the conversion of T4 to T3, the more active form of thyroid hormone, actually happens in the liver. That's where the main process starts. Yeah, with the deionization, which is taking one thyroid hormone off of the iodine hormone off of the tyrosine molecule, which is T, the T aspect of T3, T4. So another reason obesity causes a lot of inflammation and also worsening cascade of inflammation, obesity, is that the HDL particle, the good cholesterol, is produced in the liver and to some extent the intestines. So when the HDL starts to decrease because the liver cannot produce as much HDL, the bad cholesterol, or LDL, or inflammatory cholesterol, starts to rise. HDL is required to sequester back the LDL in the body through a process called reverse cholesterol transport, otherwise known as just pretty much the process is where the HDL, the high density lipoprotein, which has a heavier weight, goes through the bloodstream and sticks onto the LDL and collects it back. When that doesn't happen enough, what happens is the LDL, the low density lipoprotein, very inflammatory, it starts to line the blood vessels and starts to stick onto the lining. And when that happens, the body will think that it needs to wall it off to protect the body. So then what happens is the blood vessels start to narrow. And that's where there is a big association with hypertension and things like atherosclerosis, which is hardening of the arteries. This is all exacerbated when the sugar is high, because when the sugar is high, there's a process called glycosylation, where the blood sugar molecules start attaching to tissue, and in this case, the blood vessels. So thereby, again, causing more blood viscosity, thickening, and hence stroke risk and inflammation. And so that is one cause. The another thing that obesity is associated with high triglycerides. So when the blood sugar is high in the body because of fatty acids in the liver, fatty liver, the sugar in the blood is already high, so the body will actually convert most of the carbs and sugars you eat into triglycerides to help store for later use. However, the issue with high cholesterol, high triglycerides, high cortisol is that shunts the fat storage to the belly, to the abdomen, which then, is again, very well known to be associated with stroke, heart attack, and other inflammatory issues. That's why there's such a big association. The final thing that I want to share is that when the liver is congested, there's trouble metabolizing excess hormones such as estrogen, and that includes environmental toxic mimickers of estrogen, such as xenoestrogens or artificial growth hormones that is often in the foods, as well as pesticides, herbicides, petrochemicals, and there are hundreds of different toxins that the liver begins to have trouble to detoxify. And when that happens, of course, the hormone imbalance happens and endocrine disorders start to happen. There are various mechanisms and how it affects different organs. But the number one example is like what I mentioned earlier, where the liver, has trouble converting the T4 to T3, and hence through other cascades also causing hypothyroidism, including the evolutionary survival mechanism. Another thing that happens if the liver is toxically overloaded is that the body actually produces more fat in the body to hold the toxins. The reason the body does this is to protect the brain. The brain has a lot of fatty acids, and the body creates more fat around, like visceral fat and other parts of the body, to actually protect vital organs such as the brain from getting toxically overloaded. And so one thing to know is also that there's such difficulty losing weight because there's a whole cascade of the stress hormones of cortisol. People think that they think that the high intensity or the more cardio would solve the situation. But if you look at the reality, the weight loss industry is such a big industry because that simply doesn't work for most people. In order to get really muscular and very strong and very lean from intense workout, is there has to be already a level of balance in the body, especially cortisol, stress hormones, and also having a clean liver. So what happens when people start to go in and cut the calories and start to work out is that it worsens this survival mechanism because the body already thinks it's starving because of insulin insensitivity. Sugar is not going in. So cutting the calories, people going on calorie restrictions actually exacerbates the problem, causes more cortisol, more muscle breakdown, and difficulty gaining muscle mass. And what happens is that also worsens the situation. Exercise, anytime you have high intensity workout where you're losing your breath and not able to hold a conversation, that stimulates more cortisol, and then more inflammation, and then more difficulty losing weight. So again, an unending cycle of difficulty losing weight. In fact, even weight gain from intense workouts. So yes, those are what I wanted to share. I'm sure there's a lot of other associations and causes, but that is what I could think of at this moment. So thank you very much.
Oh, that explains a lot about how one affects the other system to compensate for something else, and wow, it's very revealing to see how various systems are duped and affects each other, and that explains the never-ending cycle, right? So what we traditionally used to think that, oh, okay, you exercise more, eat less, it's not as simple as that, right? You really need to understand the depth of the causes and how it affects, and that should lead us to the proper management of it. Wonderful. Let's turn it over to Pooja.
Yes, sir. I think my voice is clear now.
Yes, go ahead.
So, as we heard a few things from Ishan madam, let me switch over to Ayurveda point of view, how the obesity and its symptomatology will be going to impact on different systems and how it is going to manifest. As we Ayurveda people follow Charaka Samhita, he is the master principle, where the detailed information regarding the staulya, we call it as obesity as staulya or medo roga, both the terms, because medo dhatu is considered to be the precursor in the pathogenesis of this obesity. So we name it as staulya roga or medo roga. And this particular staulya is considered to be one of the astaninditiya, that is where it is not a good thing for a human. And we have a quotation in Charaka Samhita that Karshyameva varam staulyam. The being lean, thin and lean is considered to be a boon in comparison with being an obese. Varam, this is the blessing from the god, like that they'll tell. That means highlights and importance have been given to Krushata only, not for the obese. Now, if a person is obese, how the complications will be seen on different systems? There are main 8 factors have been explained. I'll go one by one in brief. First one is Ayusho Hasaha. The person who is suffering from obesity will have the lesser lifespan in comparison with the person who is very lean and thin. The reason may be as the Medo Dushti is seen, and this particular Medo Dushti is also a precursor for many more disorders like Medo Dosha. We commonly correlate it as a dyslipidemia. Prameha, we commonly correlate it to the diabetes mellitus, and of course many more endocrinal disorders. Once all these diseases are together, if a person is obese, many a times all these will be seen all together. Hence, obviously, Ayusho Hasaha, the lifespan itself will come down. This is the first complication, and it is not at all related to one particular system, it is for the whole system. This is first one. Next is the Javaparodaha. It's very beautiful. Patient or the person who is obese looks like the prematurely aged, though he may be 40 plus, but he may look like 50 plus. So this is once again due to the vitiation of the Medo dosha. Next very important factor is third one is Dhaurbhalyam. As of course the word itself is self-explanatory. As body is not able to tolerate the external stimuli, anything, the physical as well as physiological strength will go down because of the pathogenesis, derangement in the medodhatu. Hence, Daurbalya is considered to be one of the commonest symptom. And of course, it is a generalized symptom. It can be seen as a single entity, or it may be a symptom in association with some other complications like that of prameha, that is diabetes mellitus, or dyslipidemia. So that's why this is the third thing, which is commonest complication which will be seen. Next is very important, Daurgandhyam. We know Medha and Swedha, they are interrelated. The sweat is considered to be the mala of Medodhatu. Once the vitiation in Medha, then of course there is a vitiation in the Swedha. Hence, you will see the deranged functions in the sweat glands and this mechanism of sweating. So that's why Dhaurgandhya is also one of the complication which we will see in a obese patient. Next, Swedha Bhadaha. See here, very important, a general entity which has been quoted that lot of difficulties which related to the sweating mechanism. It is not that only the excessive sweating, many more things have been to be considered. I think many patients will tell they'll see lot of sweating over the palms and soles, and this is once again an important symptoms has to be taken into consideration for the treatment protocol. It should not be neglected. Of course, this is also one of the commonest complication as well as a symptom which will be seen a person who is obese. Next, Kshudhati Matra and Pipasati Yogascha. These two again, excessive hunger and excessive thirst. So these are all once again a generalized complications which will be seen a person who is suffering from the obesity. Cause may be different thing, cause for the obesity may be different, but these symptoms will be very commonly seen. And last and very important is Kritra Vevayata. There is a difficulty in sexual intercourse or the sexual actions. So this may be leading to a very important manifestation, that is infertility. And of course, this is considered to be the biggest issue. So in general, in Ayurveda, we don't have the specific application of Staulia over different systems, but the generalized symptoms what we have quoted now, Ayusho Hasaha till Krishna Vevayata. These are all the looks like generalized symptoms, but the person who is prone to suffer from a particular disease, he will be manifested with that particular symptom. For example, if a person is having more prone towards the Shukra Dushti along with Meda, the manifestation will be in the form of infertility, and the infertility will be due to the dysfunction in the sexual action, the sexual dysfunction, that we call it as the Kritra Vevayata. Of course, like that, we don't have a direct explanation over the individual system. Instead, these main 8 symptomatology which have been explained in our classes are having a more implication towards different systems. This is regarding the obesity and its complication over different systems.
Wonderful. Yeah. So, yeah, even the Ayurveda clearly explains how the obesity could manifest in different people based on their dosha and their body type. Interesting. Very good to know. It reveals in depth the issue in different perspectives. Thank you. Now let's turn to Dr. Prema on her approach to her revelations on how it affects the body from a clinical and allopathic perspective.
Nityanandam. So I'm going to explore the weight-related implications on health. So evidences for this are overwhelming and indisputable. So I think that the allopathy approach is to system by system, and I think Ishan and Pooja explained very beautifully the same pathogenesis affects almost all the organs in the body. So I'll be focusing more on women health and system by system. Actually, obesity and overweight is associated with 60 comorbid conditions in human. I'm going to be mostly, again, focusing on a women health. So basically, in a teenager and young adults with overweight and obesity, they, like as Ishan explained, there is chronic and ovulation, menstrual irregularities, and hirsutism, acne. 50% of this population have polycystic ovarian syndrome based on like insulin resistance and increased blood sugar and inflammation happening at the ovaries. And also psychologically, this group of women go through depression, low self-esteem, isolation, sometimes even a substance abuse. As the early onset obesity continues, women faces with fertility issues, so infertility. 1 in 7 couple face infertility. As the Pooja was saying, the infertility in Ayurveda, even to begin with, difficulty in intimacy. And medically, how does it affect women with obesity and overweight? There is infrequent ovulation or no ovulation. The quality of egg is very poor and it affects the embryogenesis. Even if the woman conceives, the early miscarriage, spontaneous abortions, and recurrent abortions are very common with this population. So what are the effects on pregnancy? So the obesity is a serious health issue during pregnancy. During pregnancy, that mostly like it's very difficult to conceive. Even if they conceive, there is a high risk of miscarriage and recurrent abortion. And when a woman continues to continue the pregnancy, and in the second trimester, they develop a gestational diabetes mellitus. Again, the background of this is the same, like insulin resistance and high blood sugar, and it affects the woman. Like the percentage of this gestational diabetes is more than 50%. So the gestational diabetes affects maternal obesity, big kids like a 9-pounder and a fetal jaundice and increased risk of C-section. And towards the early third trimester, they are high risk for preeclampsia. Again, high blood pressure, intrauterine growth restriction, and during delivery, these women go through dysfunctional labor and also increased risk of cesarean section. And postpartum, there is increased risk of blood clots and postpartum depression. So at every level of in conceiving to be pregnant and managing the pregnancy and postpartum, there is an increased risk throughout. Then how does it affect the liver? I know Ishan discussed beautifully about liver, fatty liver, and the number one cause for non-alcoholic fatty liver now is the obesity and overweight. So again, there is a tissue damage happens at the liver, and she beautifully explained the chemical, like increased inflammation and increased level of C-reactive protein and cytokines and steroid levels. So initially it affects the liver at a cellular damage, and then it makes the liver fibrosis and cirrhosis, and in rare cases, even increased risk of hepatocellular cancer. The next to liver is the gallbladder. So in gallbladder, when we study, we say a fatty, 40, fertile female. So it's fatty, 40, fertile female has increased the risk of gallstones. I have seen many times during pregnancy when overweight and obese women develop gallbladder stones and requires surgery, like increases the risk of cholecystitis, and very rarely, like it can lead into gallbladder stones too. Then again, obstructive sleep apnea. So majority of these women have sleep apnea with a poor quality of sleep and poor oxygenation, increased carbon dioxide level. And also it makes the women, the population very tired, irritable, anger, and poor quality of life and poor production. So it does affect the sleep by apnea a lot. Then the studies are showing the higher the BMI, like the overweight and obesity, and by measuring their inflammatory cells in the body, like again, C-reactive protein levels are pretty high, and then cytokines, tissue necrosis factors, steroid levels, they are measured significantly higher. So this forms the pathogenesis for developing a type 2 diabetes, chronic hypertension, hyperlipidemia. These are the base for cardiovascular issues and stroke. As Ishan was saying, there is a damage happens at the at the cellular level because of increased lipids, increased stickiness, and platelets, makes the little damage again and then form little clots, so it increases the risk of stroke. For the stroke, there is a huge study from JAMA, the Journal of American Medical Association. It included 116,000 women aged from 30 to 55. They followed them for 16 years. There is a significant increase in a stroke history with obese and overweight women. It actually exceeded the other risk factors like aging, including smoking, hormone use. So this is one of the major contributors for the stroke in women. And when it comes to cardiovascular problems, the heart failure rate is very high. With overweight and obese population, the pathology is again the same. And what's the effect of weight, the overweight population on a pelvic floor function? I'm a incontinence specialist. I do most of my practice in pelvic floor health. There is a significant damage happens to the pelvic floor muscles being obese, and which increases the risk of urinary incontinence. There is two different kinds of urinary incontinence. One is stress incontinence, where women accidentally leak urine when they cough, sneeze, and during any activity, which brings again so much suffering for the women. So 57% women with overweight and obese populations suffer with this compared to normal weight range. Again, the bladder dysfunction by overactive bladder, which is using the bathroom more frequent and waking up in the night. Again, it's a quality of life issue, and it is higher, 27% in obese and overweight population. And by American Association of Orthopedic Surgeons, these facts are from them. The impact of overweight and obesity on joints and bone health. Again, the tissue damage happens in and around the joints. And 1 pound of extra weight puts pressure of 4 to 6 pounds on each joint, especially on knee and hip. There are 25% increased knee replacement and hip replacement in this population. It also affects the foot, causing the foot pain and tendinitis. And this again, the same group reports the post-operative complications, the time to do surgery and the complications during surgery like bleeding and post-operatively delayed healing and increased risk of blood clots. And also the recovery takes longer time for the knee replacement and hip replacement in this age group. So basically, like the skeletal system is very much damaged by this population group. Then very interesting thing, this obesity and overweight can cause 13 different cancers in women alone. Like I wasn't focusing more on overall population, but I think it relates to all, like including men. But in women, there are 13 different cancers directly related to obesity and overweight. I know majority of us and all the general population think that the cancer is an inherited problem. No, it's not true. Mostly like the external factors contribute more to the cancer. So two most important, the uterine cancer and the breast cancer. So the uterine cancer usually happens around menopause and after menopause. Again, as Ishan was explaining, the estrogen levels in this population is pretty high, and endogenous sex hormones, they are high. So what does it do? It increases the proliferation of the lining cells in the uterus. So basically these women start bleeding again or start bleeding post-menopausally, and their lining of the uterus is pretty thickened. And these, again, the studies show that 37% higher risk of uterine cancer in overweight population. And again, an interesting thing, these cancers are pretty high metastasis and failure of treatment itself. And because I think it's a continue to do tissue damage all over. And if a patient has a uterine cancer, along with, they also have high blood pressure, diabetes, and other tissue damage all over the body. So it makes sense. The cancer, not only it's a higher incidence, and also the higher metastasis, and also it's resistant for treatment. And the last one is again a premature death. Pooja explained beautifully very first and they look premature aging and also a premature death. So the study of 3.9 million of adults with this issue proved there is a premature death, 1 in 5 premature death in United States. 1 out of every 5 premature death is because of obesity and overweight. And in UK, it's 1 in 7 premature death because of this. So by summarizing all of it, by listening from Ishan and Pooja, basically the fat cells, increased fat content affects every organ, initially causing a tissue damage and increasing the inflammation all over the body. And once this inflammation continues and there is a more and more damage happens, depending on which organ is affected. If it is a liver, it's a non-alcoholic fatty liver. If it is a heart, it is a atherosclerotic heart disease and heart failure. If the thyroid issues, Ishan was discussing very good, it's all interrelated. If it is a woman, begin with failure to even have a regular menstrual cycle, and then failure to conceive. And if they conceive, there are a lot of issues with pregnancy, postpartum, and also it affects the bones, it affects the skin, it affects joints, it makes many cancers, and also a premature death. Yes, it is a huge problem which affects physically, emotionally, psychologically, socially, and economically. So I think like we all three of us discussed in detail, but when you look at it, is the baseline is the inflammation, tissue damage, and progressing into the disease and premature cancers and premature death. So that's my summary of this.
Wonderful. It's listening to the 3 different perspectives, you can see how the common underlying issues are illustrated in different ways in terms of aging, how it affects the other system, premature death, and how it affects the other organs and everything. That really shines a light into this darkness of misunderstanding the issue about health. As we all know, the solution to any problem or any issue is removing the darkness, right? So you just basically shown a very beautiful, enlightening light into this darkness of misunderstanding what obesity and overweight is. So I can't wait to have you all back again the next time when the management and solution to this problem would be discussed. Now that everyone who has been watching this series would have fully and in-depth understood the cause, the why, and how these issues happen and how it affects the rest of the system, so that would set the mindset, and they'll be in the right receptive space to take on the management and solution of this. So if there's anything that you would like to add before we conclude?
I want to add, Kumar. So I know Swamiji's vision of Hindu doctors beyond borders are actually to serve the world, to whoever in need of, whether it's a knowledge, whether it's a consultation, that I want to invite many doctors around the world to join our group and to share our knowledge, share our experiences, to begin with empowering and understanding each and every problem, that we will continue this with many other specialties. I will be inviting ophthalmologists, dermatologists, internal medicine doctors, and also and many other naturopathy and Ayurveda, alternative medicine. They play a major role. And if they all given the priority of beginning with naturopathy doctors and Ayurveda in first place, we won't have no disease and less role for allopathic doctors. So I do want, as per Swamiji's wish, this should reach out the entire world, and everyone who is in any corner of this world can access us for any of the issues, including knowing about herbs to naturopathy based of a healthy lifestyle. So this is our Swamiji's wish, and we all want to do this in a larger scale, and with many, many doctors joining this Hindu Doctors Without Borders. And we will continue this enriching, to begin with knowledge first, and then consultations, and maybe in person we will do a lot of medical camps and treatments, and we will even go remotely to do this service to the world. Thank you.
Again, I thank Prema, Ishan, and Pooja to join in this wonderful discussion. And I invite all the listeners and viewers to tune in for the next session that will happen in the next few weeks. Let's end with Purna Mantra.
Purnamada Purnamidam Purnamudachyate Purnasya Purnamam Purnamedhi
Shanti Shanti Hari Om Tat Sarvam Bhagwan Shri Nityananda Param Shivam Padarkanamastu Om Nityanandam